Hello, I'm David Trickey. I'm a consultant clinical psychologist specializing in working with traumatized children, young people, and families, and I'm also co-director of the UK Trauma Council. What is good enough evidence? Well, listening to the voices of young people about what has worked for them is one level of evidence. And this can teach us a lot. It can tell us what is important to young people and can provide some ideas of how to adapt evidence-based interventions. But ultimately, that will only ever tell us about their particular individual experience. And listening to experienced clinicians can also provide key insights into what has worked in their experience and how to make things work with particular populations of young people in particular circumstances. And academic published research, though, can really tell us what is most likely to make a difference. Some studies simply measure how young people are doing before an intervention and how they're doing after. And as long as they're using reliable and valid measures, then that could be helpful. But how do we know if it's the intervention that actually led to the improvement? There are some studies that will compare the outcomes for young people receiving a particular intervention to the outcomes for young people receiving something different or no intervention. Now that can give us even more information about whether something is effective. But how was it decided which young people would be in which group? Did they choose? Is it because they happen to live in one area or attend a particular school? In those cases, there may be other things that are leading to the differences in outcomes. Maybe certain types of young people tend to choose a certain intervention. Maybe there are other things on offer in certain areas, and that's what's helped. So the best way to work out if an intervention is actually making a difference is a thing called a randomized controlled trial, or an RCT. Now here, young people who are eligible will be randomly assigned to a group. One group will receive the intervention and one group will receive something else or nothing. Then when you compare the outcomes of the two groups, you can really start to assume that it's the intervention that's making the difference. And for some mental health difficulties, there have now been so many RCTs. The research is able to pull these results together and perform a meta-analysis, which is really just a fancy way of combining lots of different studies so that we can be more confident in the results. It's these RCTs and meta-analyses that gives the most reliable information about what is most likely to make a difference. And usually those are the studies that NICE will prioritize when making its recommendations. Effective adaptation or flexibility within fidelity. Now, what we mean by effective adaptation is staying true to the key principles and mechanisms that have been proven to make an intervention effective, and then adjusting delivery to fit the young person's particular way of being, their preferences, and their context. So, for example, some young people might need shorter sessions. They might need carers to join the sessions. They might need carers not to join the sessions. They might need more play built into the session. They might need the language adapted, but not at the cost of the core elements of the intervention. It's just a matter of packaging things in a way that the young person can best make use of. I guess it's a bit like finding a way to make medicine palatable to a child. You might add something that makes it taste nice, but if you then leave out the active ingredient of the medicine, sure, the child will take it, but it's not going to work. What could commissioners and other decision makers be asking? Well, you could be looking for services that can articulate why they're doing what they're doing and not just what they're doing. So you could ask, what's the evidence behind your approach? Now, you might want to ask some follow-up questions there to really find out if the service is drawing on actual evidence and not just some ideas that seem sensible and are being packaged in an appealing way. You could also ask, how do you adapt things for children in care? How do you make sure those adaptations still reflect the evidence base? How do you know it's working? How do you involve children, young people, and carers in shaping your service? Commissioning for learning, not just delivery. Services are in such a powerful position to really learn about offering evidence-based interventions in a way that works for children in care. So you might want to find out about whether a service has ongoing staff training and supervision, reflective practice and team learning. And do they monitor outcomes in a meaningful and valid way, not just ticking boxes? You might be in a position to commission services that monitor, reflect, learn, adapt, and share that learning. What voices can shape the work? Well, of course, the best people to ask about how to provide a service in a way that's going to be acceptable is to ask the young people and their carers. You might also want to commission a service that is asking practitioners, are the services that you commission listening to children and young people? Are they engaging carers and foster carers? Are they valuing practitioner wisdom alongside research evidence? In summary, evidence-based commissioning is about knowing what works, supporting skilled adaptation to fit the particular needs, preferences, and context of children and young people. Mental health interventions may need thoughtful adaptation, but children and young people in care deserve and need access to the same high-quality interventions as other children. So for more information, please look at the UK Trauma Council website and also refer to the other modules in this training package.